Good day, ladies and gentlemen. My name is Hagni Wardoyo from Faculty of Medicine, Universitas Mataram, Lombok. Today I'm going to present my research paper called Association between Duration of Daily Contact, Working Period, and Biosecurity Practice to ESBL-Ec Colonization in Poultry Workers, Teruwai Village, Lombok. This is the table of contents of my presentation. For the introduction, the spread of microorganisms does occur naturally as part of a survival-driven instinct, and their spread also bring their natural characteristic. An example is antimicrobial resistance. E. coli is the one of important healthcare associated infection pathogen, which means pathogen that we acquired in the hospital, and the ESBL-Ec is one type of multi-drug resistant E. coli that is difficult to treat and significantly increase in mortality compared to non-ESBL-Ec. The prevalence of ESBL-Ec in the world has been increased significantly by 5.38%, including in several countries in Asia. In Indonesia itself, the prevalence of ESBL-Ec in major hospitals is around 52%. In Mataram, E. coli is the highest ESBL isolate, which is around 38.2 among Enterobacteriaceae genus. This is our location of the research in the central Lombok Regency, Teruwai Village. Why colonization? We study this because colonization of ESBL-Ec, there's a potential threat of having severe infection in the future. This potential threat could be detected in healthy human right now, and the risk of acquisition could be analyzed later on statistically or molecular relatedness. Interestingly, research carried by Luden et al. 2019, the highest prevalence between among pig farm, chicken farm, and cattle farm, highest rate would be in the chicken farm. This could be maybe the density of the chicken, or maybe the immune system that is not as complete as pig or cattle. The research in the book was showing that the 25% of broilers stool sample is positive ESBL-Ec, and the study in the Netherlands concluded that people who work on the poultry farm have a higher risk of becoming ESBL-Ec. So the theory will be exposure. There's two hypotheses of exposure is one of the risks of associated with ESBL-Ec. The first is the duration of the time, and the second is the concentration or the dosage of the ESBL-Ec firstly contact. Method. We have a cross-sectional design location in the Teruwai with the subject of poultry workers. Inclusion criteria, of course, poultry worker who have agree as a subject, being 18 years old or older and willing to answer questionnaire, and followed by rectal swab. Exclusion criteria is intensive poultry worker who meets the inclusion criteria but not willing to have a rectal swab. This is the research flow. After obtain informed consent, we educate subject to self-obtain of rectal swab, and we bring to the laboratory for identification of ESBL-Ec and then data analysis. This is the identification flow in the laboratory. This is the swab of AMI swab, and we dilute in the saline and the inoculation in the McConkey agar plate and the EMB plate, agar plate. You see that the reddish colony, this is the E. coli that we obtain, and the green metallic colony is the we can say this is presumptive diagnosis of E. coli. After presumptive diagnosis, we proceed with the biochemical test of IMFIC. If the result is doubtful, we should continue with the commercial biochemical test. This is IMFIC, the acronym from indole, methyl red, Vogus Prescoer, and citrat. And we do screening ESBL using this antibiotic dish, ceftazidime aztreonam, which diameter and inhibition zone would be equal or less than stated in the table. If one or more than one are confirmed with the inhibition zone equal or less, we continue with ESBL confirmatory test with DDST, double dish susceptibility test, double dish diffusion, carry out using amoxicillin clavulanic in the center and the cephalosporin third generation and the fourth generation. This is showing that it should be inhibition zone circular, seem like extrapolated or exaggerated after meeting this 3 antibiotic. This is confirmed as ESBL-Ec isolate positive. As the result, the characteristic male and female comparably the same. The age is we have 65 years in only 2 subjects, and the respondent criteria dominated by owner who also becoming a worker. In the study, we also studying about a biosecurity parameter, which showing that personal protective equipment is not used to all subject, disinfectant is not used to all subject, and all subject did not wash their hands. And this is the table showing that the association between duration of daily contact and working period to ESBL-Ec colonization. As we can see that 2 hours or more and less than 2 hours, we have comparable the same of positive ESBL-Ec, and the chi-square test showing that not significant. In the working period in 3 years or more and less than 3 years, we see that the great difference in positive ESBL-Ec, and the statistical tests confirm that is having significant. And biosecurity practice parameter, we examine 21 parameter, which is include the protective personal equipment and the disinfect and the not washing hand in the previous slide is included in the 21. Among 21, there is 3 parameter that is statistically significant. They are sick chicken isolation, biosecurity training, and quarantine seat. This is significant. And the discussion, we can say that the other research is confirmed that the duration of daily contact showing the same pattern in the dumps et al. 2015, showing that the poultry worker who have positive ESBL colonization have a higher mean of duration hours that compared to negative ESBL-Ec, although this is not statistically significant. And the other research by Hujber 2014, there is a significant association between duration of daily activity in the poultry house and the incidence of ESBL-Ec. Duration of daily contact is consists of irrational use of antibiotics and poultry fed, intensive livestock management practice. This is adding with the poultry density and the workload of the worker, and the concentration of exposure itself studied by Black. We can say that the accumulation is becoming ESBL-Ec colonization. This is the example of concentration exposure. Of course, the human fecal is the highest. This is per gram, this is per kilogram, but the acquisition could be from anywhere. This picture showing that the multifactorial that affects ESBL-Ec colonization. More than 65 years old is more susceptible, of course. Male is more susceptible. Previous illness is more susceptible. Biosecurity, lack of biosecurity practice is more susceptible. Water is a source that is not clean is more susceptible, and poultry density, the higher poultry density is more susceptible. For working period, we can see that studied by our is showing in line with our research, that is occupational exposure is a risk factor that is significant associated to occurrence of ESBL colonization in the poultry worker. Also research by Ben Amy showing that the age of start working is important as well, and the tennis in 2018 mentioned that working more than 3 years is one of the risk factor of ESBL-Ec carrier. This is the working period, showing that the working period with more than 3 years makes the ESBL colonization becoming carrier condition. And how do we gonna decolonization? It takes at least 1 year or more to becoming a normal condition. This is the colonization of ESBL-Ec in human can have impact on health issue in the future, and the higher morbidity is found in the ESBL-Ec positive. Therefore, the research is importantly to conduct. And 21 biosecurity practice parameter that we examine, that is represent 7 structural biosecurity and 14 operational biosecurity, which means 14 is consists of policy, procedure, and so on, and 7 is related to structural. Only 3 of them had significant association with ESBL colonization. They are sick chicken isolation, existence of quarantine set, and recent biosecurity training. Number 1, isolation of sick chicken. Interestingly, there is general awareness among majority subject in keeping visitor as minimum as possible, not because of biosecurity reason, but because of stress of the chicken facing strangers in the farmhouse. And the second, isolation of sick chicken needs a special place like quarantine seat. In the study, the existence of quarantine seats tends to increase monitoring activity of sick poultry. Those after test statistic had a significant association, and the biosecurity training have an association. Interestingly, based on information from local, after 2014 that governor declared Teruwai as a poultry favorite, there is periodically farming visit, farming bureau visit, monitoring, giving pesticide, DOC, day old chicken distribution, training on biosecurity, training on egg production or meat production. After training, there is a follow-up, occasionally done with free distribution, vitamins, and even day old chick. This is very motivate them. Study limitation, of course, the number of the sample and the chance of under-detection of E. coli due to self-obtained swab sample by the subject itself. No cloacal swab sample from the chicken for the confirmation. And the conclusion, we can say that the working period have a significant significant association with the ESBL colonization, while the daily duration contact is not significant. Biosecurity practice, which is significant, is isolation of sick chicken, existence of quarantine set, and biosecurity training. Okay, this is some of my reference, and thank you very much. Goodbye. Wassalamualaikum warahmatullahi wabarakatuh.